My name is Jem Dieter, and I work with Eagle County Public Health and Environment. And
I am Mandy Miller. I also work with Eagle County Public Health and Environment.
And we are here to talk a little bit about our mental health strategic goals. So, Mandy.
Yes, Jem.
We are 2 months into the school year. Tell us a little bit about what's going on with our school-based counselors.
Yes, so 2 months into the new school year, and as most of the community knows, your Hope Center does have school-based clinicians, again, in all of our public schools here in the Valley for another school year, which is a fantastic feat. 6 bilingual clinicians this school year, which again is a bit of an increase from last year, so they're better able to serve our monolingual Spanish students and their families. So yeah, off to a really strong start as far as the staffing goes.
Awesome. Tell us a little bit more about like the mental health landscape. Like, how are the students doing?
Yeah, so great question. So in terms of what your Hope Center is reporting, and again, they're a bit more on that higher need end of the spectrum for mental health. Really exciting to report in the first 2 months of the school year, there have only been 68 crisis cases compared to 100 last year.
Oh my gosh.
So a really big reduction between last year and this year. Hopeful that it continues that trend. But the other really great news is that with that reduction, the clinicians have more time then to meet with students, meet with their families, and provide services before students get to that crisis level. And so this is a really important shift in that work. The clinicians have also had some time too now to start to support peer groups around common kind of issues and challenges. So depression, anxiety, so trying to stand those groups up in the high schools and the middle schools. Again, just to, help prevent before we get to a level of crisis.
Absolutely. So, that's super exciting.
Yeah, it is. It's really great news to share.
Is.
And what about you? Family Connects has been with us for 1 year now. Jen.
1 whole year.
I know.
Blows my mind. Feels like a year, feels like 10, sometimes like 2 weeks, it's all over the place. But yeah, I am really excited to say that Family Connects has been around for a year, and it has been a year of learning and partnership, which is really awesome. Typically, I share a little bit about our population reach, but I really want to spend some time today talking about what people are actually experiencing through the program. So I'm just going to read this quote from Jeanette. She is one of our nurse home visitors in the program, and she shared this quote with me about her experience over the last year. She says, "I can't believe it's been a year. It has been exciting and rewarding to be a part of launching a program for families. It has opened my eyes to the needs and inequality that some members of our community experience. I've really enjoyed helping families connect with local resources that many don't know about. Whether it's a new mom or a mom with multiple children, I have found that support, education, and reassurance has made difference in decreasing stress levels in the postpartum period. Our team is giving families the best chance of raising children, and we are truly humbled by our ability to work so closely with families. Our community is fortunate to have Family Connects, and I feel blessed to be a part of such a wonderful program." She says it so well.
Oh,
I couldn't
so
say it better.
inspiring.
I know.
Wow.
And then just to share some feedback that we've gotten from some of our community members, we do have what's called a post-visit connection call that happens 4 weeks after a visit to check in, see how they're doing, if they were actually able to get connected to the resources that we talked about, if we need to go back, if they have any other questions, all of those kinds of things. And these are 2 things that we gathered during those conversations. So one mom of 4 shared, "Amazing, awesome. I wish it was implemented a long time ago. It was convenient that a nurse came to the house. I loved it. I got information on some things I didn't know." Another mom shared, "So wonderful. I have been telling everyone about it. It was nice to have a combination of information about the baby and mental health. It was nice to be in my house. We are lucky to have this program in the county. I didn't have that many questions, but it was good to know that if more support was needed, it was available."
Oh, that's
So
great.
cool to hear.
That's great.
And then finally, just some kind of ways that we're interacting with the health system as it relates to folks in that postpartum period. So we urgently referred 2 clients back to their OB provider for high blood pressure / preeclampsia. In both of these cases, the RN was able to get the client into the clinic quickly by contacting the provider directly. So that's one of the cool things about the timing of the visit, is that there could be some things that are missed between when the baby's born and then in that 6-week postpartum checkup. So it's good to kind of have something in the middle to say, you know what, some of those vitals are off and we might want to take a look at that. Additionally, an RN noted that a newborn had not passed their hearing screen at the hospital. The RN helped the client schedule an audiology follow-up appointment, and that was mostly due to a language barrier. So that was something that was missed that we were able to kind of step in and support with. 12 clients have been enrolled in other long-term home visitation services. So Family Connects is really short-term. It's designed to get folks what they need at the time, but then kind of make it a little bit more customized, if you will, if folks are like, you know what, I need a little bit more ongoing support. And so some of those folks have gotten involved with some longer, more intensive home visitation programs. And then finally, another cool part about the program is we have the visit that happens around 3 weeks post-birth. But if there's something that happens in that time between baby's born and that visit that maybe the pediatrician is noticing or the family's noticing, and they're like, can you just come and check this one thing? That's something that we can go in and do. So we've had 4 pre-in-home visits that have been done at the request of the OB or the pediatrician to provide support to the family and those are typically lactation. Lactation is a huge thing that people request support about, as well as weight check for the baby. So baby maybe went in for their 2-day appointment and their weight maybe was looking okay. Next appointment, not so sure. Let's go do another additional weight before that in-home visit and before the baby has their appointment with the pediatrician. So those are just some really cool things that we've heard about in the last year. It took quite a bit to get this program up and running, and we are beyond grateful for everyone internally and externally that made it happen. And so it's cool to talk about those actual experiences, because numbers are neat, but people are cooler. So
The stories are what makes it matter.
they make a huge difference. So thank you so much for listening a little bit about our mental health update.
There we go.
Pretty
Thank
exciting
you.
things to share.